Hello, and welcome to Social Workers Rise, where we inspire social workers to connect, expand their knowledge, and change more lives than they ever thought possible. We will talk everything social work on every level from micro to macro. We are going to hear stories of social workers who are doing big things, learn new skills, and most importantly, give you actionable steps to make a difference today. Let's go. Hello, and welcome to another episode of Social Workers Rise. It is your host, Catherine here. So I'm really excited to talk with our guest this week, Ms. Daushae Preciado. She's an MSW based out of Los Angeles, California, and she does community mental health, which I know that a lot of entry-level social workers do this type of work. It's a really great field to go into straight out of grad school. A lot of really great experience. So if you are at all interested in this line of work, make sure that you listen to this episode all the way through and send this to your colleague, because we're not about gatekeeping of information around here. We are about sharing the wealth. So welcome to the podcast, Daushae.
Hi, thank you for having me. It's a pleasure to be here. Thank you so much.
Yes, we're so excited to have you. Tell us, who are you and what do you do?
Well, I'm a clinical social worker. I've been a social worker for now about 4 years as of, I want to say May, the end of May. I got my MSW in February of 2020 during the height of the pandemic.
Oof.
Right after I got my MSW, I went straight to work and in my last placement field. So I was a substance abuse counselor for about, I would say 6 months, due to the fact that the work of being in the substance abuse population and just the height of the pandemic, it really took a toll on my mental health. So from there, I went to another community mental health agency in California, and that's where I really fell in love with remote work. It gave me the flexibility of just working with clients within the comfort of my own home. I did that for a year, and I've worked with other different variations of different areas in social work. My skills include working with mothers in the child protective services, working with clients on substance abuse, the reentry population. I also have almost 3.5 years of experience working as a medical social worker, just doing case management and linking the patients to different resources with providers and outside of the hospital setting. And I'm currently now working for a community mental health facility remotely in Northern California. And we serve different variations of populations. And with this particular model, we do a lot of interdisciplinary work. So we don't just work with the psychologists, we work with psychiatry, medical, dental, vision. We do homeless outreach. We do street fairs. We do a lot of connections with the disabled population. And my favorite population of all time is the neurodivergent population. And so for me, I really enjoy that because we don't typically work with the traditional theoretical orientation that a lot of us are trained in. So we have to, well, luckily we do have to work outside of the box just so that we can be able to utilize these tools and techniques for that particular population. And so, and I get them all. I get them on a daily basis, which can be stressful, but it can be also rewarding at the same time.
Definitely. So I love the variety of work that you have done. And it just reiterates the fact that if you're not getting your quote dream job right out of grad school, it's okay. It's okay, because there's so many different ways that you can go in your career, and there's not one straight path. So would you say that these different experiences have helped your work now and what you do and where you are?
Oh, absolutely. A lot of times when I get clients on a daily basis, it usually happens to be anything that's particularly tied into my previous background. So I had a client that that is now, he had diagnosed with autoimmune disease, and he had different comorbid diagnoses that really pertain to his mental health. And so when I came to him, I had asked him, basics, how's your health? Are you doing anything particularly to put a put some detriment on yourself? So I usually ask water intake, food intake, and so he just told me, that his diet has really been a significant part of his mental health. He was really moody, irritable, an increase of anger. So one of the things that we did was I sent our team a message to get him set up with the nutritionist that we do have on staff, made sure that he's connected with our psychiatrist to get him some medication to subside the ongoing significance increases in his anger. Plus, he already has AA, which is great because he's a recovery alcoholic. And then on top of that, we connected him with his medical provider. So we're really trying to integrate this whole person care model within the community setting, because 9 times out of 10, our clients don't necessarily have the voice to advocate for themselves because of financial stigmas, because they're not citizens, and the fact that there are a lot of bad reputations with how providers perceive them. And so we really try to be that point of contact for them, and try to establish the need to be able to have proper medical proper medical care, proper care for our bodies, integrate the whole, spiritual aspect of it, just because we're dealing with not just the person, but we're dealing with many parts of the person. And that's something that we definitely try to establish within that care model.
Definitely. So, in a nutshell, what do you do as a community mental health worker?
So I'm so glad you asked, because a lot of times, when we work in the community, our population, especially, we tend to do case management. As my job, I do individual therapy, which is such a rewarding job, because we are the point of contact now. And because we build that level of rapport with our clients, that they really turn to us as a way to kind of pivot them to get these different services. And part of my job is to make these distinct connections with their medical providers, with their psychiatrists, with, other medical teams, to be able to be part of their care team. And so for me, I just try to make sure that I provide as much education as possible for them to be able to make that distinct, sorry, I lost my train of thought, that distinct care and decisions for them to be able to see if they need a checkup, or if they need a women's health wellness check. And that's so critical now, especially within the past 4 years. It's after the pandemic.
Yes, definitely. Definitely. So, I'm wondering, as a community mental health worker, what does a typical day in the life of your job look like?
Wow. It varies. Some days are heavy, some days are light. Typically, our with our model, we definitely have to meet productivity. We definitely have to see anywhere between 7 to 12 patients within 30 minutes, because we operate on a brief healthcare model. And so we try to make sure we meet that quota as much as possible. Now, granted, there's going to be times where clients will no show, that they will have to reschedule, where we do have to make referrals outside of that. And so we're definitely utilizing that time to get everything done for the client. And so 9 times out of 10, we're talking to, we're talking to people in the courts, we're talking to caseworkers, we're having to advocate for their medical providers to get them seen by a doctor. I have a client that I saw yesterday who was trafficked, and she had no access to medical providers as well. So I had asked the team to schedule her an appointment with a provider and to give her, resources for housing. Even though she was already in a residential facility, we still want to make sure that we're providing those resources. And we do have a case manager on staff, which definitely takes the burden off of our day, because when we're looking for resources for clients and we're looking at certain cities or communities that may not have those resources, so sometimes we have to go outside of that box and look at other resources or collaborate with other providers because they have more resources and more knowledge of certain services than I do. So I really heavily rely on my team for that.
Yeah, yeah, definitely. Because that's a lot of extra work. Case management is a lot of work. I wanted to clarify, you said how many clients are you seeing per day? Because you said 7 to 10 clients in 30 minutes. Is that right?
Right. That's right. So the way it works is that because we operate on a brief care model, we scheduled typically 12 clients. Out of those 12 clients, we may see 7 or we may see 5. So it really varies on what type of referrals we get, and it varies on if the clients will show. Some of them won't show at all. Some of them will. So we understand that, you know, everybody has different things, and sometimes when we're operating under that brief that care model, my my schedule may not be impacted because, they have other appointments with other providers. So I may not see my client until the next week or the next day because they have other doctor's appointments, other appointments with other providers. So we definitely try to utilize that time to get those appointments because again, we are funded by, you know, third party providers and stakeholders within the local and government and federal sector that we have to still show that, hey, these are the reasons why these clients did not show up for that day. And we have to make sure we document that just so that we're keeping up with the utilization review.
Okay. So then I guess I'm just want to make sure I understand. So you'll see 7 to 10 clients per day for 30 minutes?
Right.
Okay.
It,
Okay.
yeah.
Okay. That makes sense.
Yeah, because we definitely have that 30 minutes and sometimes we may not use that full 30 minutes. And so we just try to keep that in mind just so that patients and clients don't go over that because it also impacts my other appointment. And there's times where
Yes.
I do see clients, from 8 o'clock till 5, and I only get like 30 minutes breaks in between those times. And in those 30 minutes, I either do documents, I either consult with, my supervisor or my manager or my director, or I'm doing referrals. And so even though we operate on that brief care model, we understand that there are going to be clients that will need more time. So we definitely do our best to elaborate that as much as possible, and we make that referral out of our facility to a provider that can provide them with that one-on-one hour-long service, which normally that's usually the case majority of the time.
Okay. That makes sense. Yeah. Thank you for clarifying that. Hey, it's Catherine here. I hope you are enjoying this episode. We're going to take a quick break to listen to these ads from our sponsors. The next time you need continuing education units, I highly recommend the Therapist Development Center. When I started this podcast, I reached out to the founder, Amanda Rowan, to see if she was interested in being a sponsor. And she jumped at the chance to support her fellow social worker. TDC has helped more than 100,000 social workers pass their licensing exam, including myself. I love that TDC CE courses are engaging and relevant. Amanda and her experts give us clear and practical clinical skills that we can immediately apply to our work. Some of my favorites are the Edge of Life Suicide Prevention course, where Amanda shares her personal experiences, and their They Did What Law and Ethics course that looks at real cases where therapists face formal disciplinary actions. They also have a great telehealth course. We are legally required to take continuing education to increase our competence, and most other courses out there don't actually teach the material in a way that we can learn it, but TDC does. You can also check out the links in the show notes. So, my next question that I'm curious about is, what would you say is the most rewarding part of the work that you do?
Well, the rewarding part is knowing that I help somebody. And
Yeah.
that's what gets me throughout the day is knowing that I listen to them, I validate them, and the fact that I offer transparency. When we get clients that don't know, their own voice, they feel intimidated. And it's like, no, you have a voice too. And I'm very transparent with that because we are looked at as the one that's in authority, and that's not always the case, and usually there's some trauma behind that, or there's some stigma. And anytime that I get a client, I always normalize their experience, and I let them know, hey, you have a voice too. If I'm saying something wrong, or if I'm not listening to you, please let me know. It fosters not only the relationship, but it fosters healthy communication and coping skills. Because after the end of the day, they're able to utilize that experience and just those coping skills to a family member or their loved ones or their coworkers. So I try to model that and embody that as much as possible in my own daily life. And we set that example. So I just try to embody that and to know that they were able to walk out with a sense of peace of mind that they can go to their providers, they can go to their families, and just live a life that they never knew existed. That's the rewarding part.
Yes, and that's so powerful to see that transformation in people when you first meet them. They feel like they don't have a voice, they have very low sense of self, meaning like whatever everyone else wants to do, right? But for you to be able to be in that space with them and to say, what is it that you want? Right? What is it that's most important to you? Let's figure this out and let's make it a priority because your needs also matter. And to just be able to help people feel seen like that is so powerful.
It is. And sometimes I really have to direct them because they're so enmeshed in everything else that they forget about that. And I'm like, no, what do you want? What is it that you need? We're not worried about what everybody else is doing. We're worried about what you are doing. And so they're taken aback by that just because they never had that personalized experience. And that's where the breakthrough comes in, just because I was the one to let them be the center of that attention. And then I think part of that is they never get to experience that. And what helps is that when we are learning how to be client centered, we're able to get the most out of that. And that's rewarding because they know that there's someone out there that really listens to them and they value them and they validate their experience, and they can have healthy conflicts without having to yell or scream or be angry. And we see that all the time, and to be able to foster that and be patient with that, which I know sometimes it can be so hard, right? And I get it. But one of the thing too is that we really have to not embody that, especially outside of that, because it could get really hard. And we have to continue to model that.
Definitely, definitely 100%. And so you kind of touched on what is difficult about this role, but for you, what would you say is the most challenging part of this position?
The most challenging part of this position is dealing with the crisis remotely.
Oh,
I
yes.
I cannot tell you how stressful that is, especially when you're on the phone with the client and they just completely don't know how to function anymore. And when we know that, we instantly have to take, fast action because it's usually it's do or die, And so one of the things that is challenging is, okay, what are the resources that we can do? What are some ways that we can de-escalate the situation? Luckily for my team, I took fast action. I notified not only my colleagues, but my director, the manager, the front desk, and they all kind of guide me through, that whole crisis intervention. And what was really good about this was trying to get them to talk and get them to just hold a conversation. And sometimes that's all they need is just someone to just really be there and really guide them through that process. And, definitely calling the pet team. So the pet team is basically a mobile crisis unit, and they will come in. It's a licensed, trained therapist that will walk them through the process, trying to de-escalate the situation. Usually they'll have like their therapist there along with local law enforcement to guide them through. They will call 911, get some emergency medical service right away, and then they will get them connected with resources. And normally, if they're already connected with resources, we will just follow up. And so for us, we are usually the first ones there, in terms of doing everything remotely. So we're usually there from the beginning to the very end. I think my last client, she was just really, really not having anything. She ended up being assaulted. She was assaulted, and luckily with that situation, her family was there. So it made it a lot easier for me to talk to her son and have her daughter there. So that way, my client doesn't do anything to self-harm or have the means to commit suicide, which has happened before. And then having my team there and having the support from the front desk to make that initial call, to call local law enforcement, to do a welfare check. So it made the process a lot easier.
Definitely. Yeah, I can see how that would be challenging trying to do that crisis intervention over the phone because there's just not that same presence that you can bring to use your body in ways to just be like, hey, I'm right here. You're not alone. As opposed to somebody who's on the phone, they're just screaming into the phone, having a whole meltdown. I've experienced that too as a telehealth therapist. It's definitely challenging for sure.
Yeah.
So we talked about some of the good parts. We talked about kind of the average caseload. Let's talk about the money. So, what would you say is like an average salary that someone might be expecting in this type of role?
Well, it can generate from anywhere to, I would say, anywhere to 50 to maybe 100,000 a year, just depending on your start. I was very fortunate to negotiate because I have 3 years of experience when I came to my clinic where I'm at, and I really had to advocate, hey, this starting pay is not enough. I've had 3 years of experience with these different areas in social work, I mean, is it possible to maybe give me $5 more or $6 more? And I was ready to walk because I mean, why would I be working for minimum when I've had so many trainings and experience in other different parts of community mental health outside of my knowledge? I'm like, no, this is not. So luckily they came to an agreement and say, okay, after reviewing your resume again and your experience, we are going to give you your desired pay rate. So I really had to advocate for that.
Good. That's great. I love hearing that because it's a business. And so they're going to offer you what they hope that you're going to take. And if there's any leadway, I always tell people always counter back with something that scares you because the worst that they're going to say is, no, we can't do that. And then you can be like, okay, well, what about this, or what can you do, right? So I always tell people to see first, find out what the range is for this position and the agency and your location, and then be able to gauge, all right, they're offering me this, I'm going to ask for a little bit more, and be able to, like you said it beautifully, be able to justify, I've had these classes, I've had these trainings, I have this experience, and this is the salary that I need. Because while it's exciting to get any job offer, if you're not making the money that you need, it's just not going to be sustainable.
Right. And it comes based off of, working with my supervisor and having colleagues already in the field, and they're doing, their own private practice. And one of the things that I've learned is, no, if you're teaching your clients to advocate, you have to do the same thing. And it kind of does us a disservice if we're not modeling that. So one of the things that I think a lot of us social workers do is we don't advocate for pay. And it's like, no, we didn't go to school for nothing. We didn't have all of these extra classes and all of these CE units just so that we can get what their expected pay is. Like, no, advocate for yourself. Advocate that, you do deserve a healthy wage, that you do deserve to have, this amount for the work that you're putting in. And not just because we go to school, because we have the experience to apply when we get, different variations of individuals with multiple complexities, and we don't know how to apply that. And it's like, no, give me what I'm worth.
Yes, yes, for sure. And it blows my mind because I don't think people connect this part, that when you agree to a wage and you don't negotiate because maybe you're scared or nervous, or you're scared they're going to say no, right? You could be missing out on, like, I don't know, thousands of dollars a year, like $10,000 a year, 12,000, 20, who knows how many thousands of dollars. So by you being brave and stepping into the conversation, heck, even if they want to give me an extra $1,000, I would say that that conversation is worth it, because you could be leaving, I mean, literally like thousands of dollars on the table for the rest of your career. Because if you don't step into these conversations, job after job, year after year, oh my gosh, that's a lot of money you're leaving there on the table. And it's a disservice to you as a person.
Yeah, it is. And although we still have to pay for our licensing, we still have to pay for, our CE courses and other additional courses, that itself is worth a good maybe $1,000, $2,000. And if you are, and let's not count the association fees. Those association
Oh,
fees
geez.
do add up. I mean, when I was part of the NSAW, I paid $150 every year. Now I have to pay $250, which is simulated to my licensing fees. So it's like, I need to get that money to be able to still be part of, my practice. And how am I going to be able to be a part of all of these associations and my licensing and my CE units if I'm not getting compensated to be able to do that and then still work for the population? I mean, please make that make sense.
Yes. Right. And we want to be able to do our self care too, because we all have different needs there. If your jam is a massage, you need to be factoring that into your budget. So it
Yes.
sounds like, okay, there's like so much money stuff that we don't talk about. So I'm glad that we're talking about it. So, first, if you're going in and negotiating your rates, figure out what it is that you need, right? So, if you're figuring out these association fees, your rent, your car, the gas, your groceries, your massage, right? Whatever you want to budget for, know what that looks like per year. And that way you say, all right, I need X number of dollars in order to make this work. Where can I go? Like, who's going to be able to afford this? Who's going to be able to pay me this? And there is absolutely nothing wrong with that. I would say that that is the smart professional thing to do. What do you think about that?
I think it's very reasonable. If we have these expectations of getting into the desired job, we have to know figuratively what does that look like outside. Do we have enough to cover, like we discuss, like when I discuss with my clients, Maslow's hierarchy of need. Can we cover the basic needs? Can we cover our goals? Can we be able to take our loved ones out? Do we have enough money to provide this level of fulfillment that we need to satisfy our wants, needs, and expectations? So we really have to put that into practice, and it's really important to be able to have the numbers to solidify that and more if we're going to be successful outside of our careers and further and beyond. And let's not talk about retirement because that's a whole nother level
Oh,
right
no.
there.
Exactly, exactly. Oh my gosh. So we covered so much. Thank you so much for coming on the podcast, sharing your expertise. We talked about caseloads. We talked about what a typical day looks like. We talked about salary, advocating for ourselves. If there's people who have more questions for you, where can they find you? How can they get in contact with you?
Awesome. So you can contact me on my IG, Shifting Mind and Thoughts. You can also click on the link of my bio to send me a message as well. I should have my website up and running as soon as possible. I am going to actually come out with a resource for new grad students on, you know, having them to prepare for licensure, also like testing places where they can go, like an in person. So I'm actually kind of working on that, but I haven't. I had some things going on, and the month of May is also my birthday and Mother's Day. So
Oh,
I
hey.
I've literally been busy, so it's been a journey, and I'm just super grateful for it.
Good. Yes. Well, lots of great things coming. Thank you so much, Daushae. It's been a pleasure talking with you today.
Likewise, thank you so much, Catherine. Thank you for the work that you're doing for us. We really need more. We really need more of this advocacy for our field.
Thank you so much.
Thank
Thank you for listening to another episode of Social Workers Rise. If you love this episode, be sure to subscribe and text this episode to a friend. If you want more, there are a few ways we can get to know each other and work together. First, definitely subscribe to the Friday resource email list. The link is in the show notes. And that's where you can learn more about the courses I offer, including Clinical Essentials for the Future Therapist and the Pulse Basics for Medical Social Workers. I'll also be sending out occasional tips and resources and other happenings within the social work industry. And for all your clinical supervision needs, be sure to visit risedirectory.com. This is a national directory of clinical supervisors for social workers, and we also provide free resources that you can use within your own clinical supervision. Lastly, if you have more individualized needs, I do offer coaching, individual consultations, and am available for public speaking engagements for social workers and change makers. Lastly, the boring legal stuff, but very important. The information in this podcast is not meant to be a supplement for therapy, professional advice, or clinical supervision. This content is provided as is solely for informational purposes. It is not legal, health, or safety advice. I am not advising you as a therapist. Organizations should engage their own experts to ensure any adopted measures are compliant with applicable laws and standards in their jurisdictions. The opinions expressed by individuals or organizations are their own and do not reflect the views or opinions of Social Workers Rise or Catherine Moore. References to specific products or organizations do not constitute any endorsement or recommendations by Social Workers Rise.